Hey guys, Dr. Motley here of drmotley.com. I'm here with my good friend, marriage and family therapist, certified trauma professional, Miss Melanie Reese.
Hi.
Melanie has helped me with going through my old traumas, helping me go through old memories through different techniques, which I'll let her explain more because she's the professional, about Brainspotting and EMDR. Many of you out there have incorporated it, have talked to me and sent in messages, and I wanted Mel and I to have a conversation about what brought her into this, the stories she's seen, the results she's had. I'm not putting any pressure on her to tell everything, but I want to say that when she has worked with me, guys, I have really unlocked a lot of things internally, and for me, I never dream. She told me I would dream, and she goes, you may have some different thoughts, and they say when you dream, that you are processing certain emotions that don't make sense because it's part of your brain, that different parts that are trying to process it. I will tell you, I will have 4 or 5 nights of different dreams, but I feel so much lighter. And I went to my Ayurvedic Chinese medicine doc who does a lot of pressure point therapy, and since I've been doing this, he says, don't know what you've been doing. I told him what I was doing. He goes, you have been so much more grounded. And I can feel it. And even at night, my prayers, my thoughts, my meditations have been very centering. So, Mel, you can take the horn, just keep going, but what got you into therapy in the first place? Like, what brought you or drew you to it?
Therapy or trauma therapy?
Trauma therapy.
Trauma therapy. So it kind of became, as an intern, I was at the Refuge Center for Counseling, and you get to try out all different types of stuff. And it was kind of like a joke that I kept getting these like big things going on, like with clients. But I loved it. Like it didn't. I like a challenge of working with something I've never seen before. And the more I just got more interested in that, so I wanted to get trained in EMDR because that was the really big brain-based therapy that was back when I was interning. They were starting to, you were seeing that more and more. So I went and got the training and started seeing just the power that it has for healing and hearing some really, really big things that have happened to people that a lot of times we see that and they're like, man, they're going to struggle the rest of their life. But then seeing when you're doing trauma therapy, the change that you see, so letting people know that's not how your life has to continue to be. But then learning the difference between what we call big T's or little T traumas. So our big T's are the typical things like a sexual assault or a natural disaster, witnessing an event, or we hear PTSD with veterans that happen a lot. So being able to work with those things and then seeing the changes from them, and therapy is built for that, that would really help. I'm a big believer, you have to look at the person as a whole whenever you're treating them, so that involves so many different types of care, and that's kind of why we have where we are today right now, whether it's nutrition, we have a massage therapist that works and is very trauma informed and very much sees how our bodies hold it. And that's how I started seeing more and more that happen as I was working with trauma. Our natural instinct is to separate. We don't want to feel hard feelings or tough things, and we may not realize how much we're doing that, but when the act of avoiding something, you're laying a pattern in your brain that says, yes, be afraid of that, and continue to avoid it. And so the more you avoid things we fear, your brain, you're reinforcing, yes, that's something to be afraid of.
So when you have that avoidance, you're creating a pathway in your brain, like a road you're driving all the time, like we're just gonna ride and drive down this road as much as we can, hopefully put blinders on. And when you're performing, I don't say perform, when you're executing EMDR or Brainspotting, can you go through it the way you want to, like when you have eyes move in a certain position and how it affects the brain, like if you hold a trauma in the part of the brain, is that how you would describe it? Can you give me a quick description, or not even quick, whatever you want to say?
Yeah, so we have, I come from a perspective now doing the brain-based therapies that I did that our nervous system just runs the show. So those pathways you're talking about, they're neuropathways. And so that's where our information gets laid into place and we continue patterns. So whether it's your natural instinct when someone, comes at you in any way, is if it's, oh, I'm so sorry, and it's always you did something and needed to do the apologizing, or if your natural instinct is to come back at them. Like, those are patterns that have got put in place. And so using these brain-based therapies are a way to kind of clear some of those out, things that are causing us problems, but also to lay new things, new patterns, new messages into place. And our brain, it used to think we were kind of done making new brain cells about midlife in our 40s. So me and you would start to be in trouble right now.
Thanks, Mel.
So then you can actually, up until the day you die, your brain can change. And
till you die.
Yeah.
Keep going. This is
yes.
great.
Yeah, they have research that shows up until your body's not working anymore, your brain has the ability to change.
So you have the capability, if you've laid groundwork to have, let's say, negative trauma, negative thoughts, until the day you die, you can change pathways or lay new groundwork.
Yes.
And revisit those old traumas, clean those up. When you see somebody like comes in, and let's say they come in and you go, this is a whole lot. I've known just recently some people have come to you and they have already experienced, not just to make her blow up her head, but literally they go, yeah, the thing I went in there, they go, all of a sudden I don't have this urge or this need to go through there. And these people have had these problems for years. I mean, ever since I've known them, they're like, yeah, I don't feel like I have a craving or I have a need for that anymore. When those experiences come into you in the office, you say you like a challenge.
Yes.
And you see all this groundwork that needs to be laid. Do you find that more times that you have to reroute, like from a negative thought to a positive, or can you just lay down new groundwork? I hope I'm not being confusing and saying, like, your therapy, when you do eye movement therapy, any sort, is it trying just to bring awareness to the path they've been going on and that will help them set new groundwork, or do you have to instill new groundwork as you're going along? I hope that was okay.
No, I understand. And it depends on the therapy you're using. So I did EMDR for 9 or 10 years before, and then I got trained in Brainspotting. And that was from me I was working with a client and we were getting stuck on something, and another therapist, friend of mine that did Brainspotting, and then told me some about it. I was like, let's try it. And so I was like, I got permission from the client. I was like, can you come in and would you, I told my client about the Brainspotting. She was like, sure. That's one thing I love about my clients. They're all very open.
Yeah.
So I love to explore and experiment with new things, and they just go with it. So, but we came in for that, and did one Brainspotting session, and she moved right through it. So it was pretty cool. And so I was like, okay, that sells me. So I'm gonna go get trained in it. So 3 trainings later, I use that. That's my main therapy modality when working with trauma.
So, okay, so the difference between, like, let's say EMDR and Brainspotting, what's the difference between those two therapies?
That's a good question. It's one that comes up a lot, and I'll do my best and do it justice in answering it. But EMDR is a more structured protocol that I think is intended to be used almost on its own as a therapy, that you're going to do. So it's very regimented. It's got 8 phases. It uses more bilateral work with the eyes, so you'll see going back and forth, and that replicates that, in our sleep and our REM cycles. Your eyes are doing that.
Oh, and sleep, you're going back and forth. Okay.
So it's helping each side of your body talk to each other to process unprocessed memories.
Okay.
Because in the midbrain is where those files get stored. So when we experience trauma, and again, in my world, that's anything that has a lasting negative impact. And so when we experience those things, they're too much for us to process at the time. So our brain does this really helpful thing of just putting a capsule around it and kind of tucking it into that center brain, that midbrain. And that's on an unconscious level. And so we experience things in our 5 senses. So those memories can get stored in fragmented ways. So you may have heard someone, they smelled something, they may smell a fire, and then they're taken back and triggered. Or, with veterans with PTSD, they hear a car backfire, and all of a sudden they're taken back. So that's the sound, so we can store them in those fragmented ways. And so finding, like, whether it's rapid eye movement that way, or whether with Brainspotting, it's finding more of an eye position that corresponds with that. And the way that I've come to try to explain it with my clients is, if you've ever been talking to someone and as they're telling a story, their eyes keep checking up,
They move, like they'll look into a certain direction when they're saying something to you.
Yeah, so they're accessing that information in the brain. Or when your eyes gets kind of stuck on a wall or on something and you feel relaxed, and if someone tries to get your attention, it's so hard to pull away.
Yeah.
So you found a resource spot. Okay, that you just found a natural resource spot in the body. And so with these files, that's whenever we look, because our eyes are the first thing that's formed off of our brain when we're in the womb. So we have that through the optic nerves. We have like a direct connect into your nervous system, which is what runs the show and where those patterns get laid. Because a big tagline for Brainspotting is where you look affects how you feel, but then what's in the brain is in the body, and what's in the body is in the brain. So when I came across this therapy, this really resonated with me, because you're seeing the body as a whole. You're seeing the person as a whole, because, you know, with mental stuff, you go to a therapist. If it's something in the body, you'll go to a doctor, but that's why it's so important for doctors to collaborate with therapists and vice versa, because it's all just one thing that all works together. You can't really separate the two, because I work in chronic pain as one of my specialties. And there's been people who have had surgeries, and by all tests and everything's corrected. Yeah. But then if your mind didn't get on board with it, you can still have those same symptoms. And so it's whether you're working in a fear of somebody will just like my guts in knots because that they were having some gut issues. That's how they still see it and visualize it, that things are stuck, or have a fear that things won't get better. You've got to correct that and get the mind on board with the body. That makes complete sense. So with the eyes and the brain being connected to the body, and we laid groundwork with negative thinking, with trauma, and that's created a connection, synapses with a certain part of the body. That body feels that continuous thought, and you keep relaying that thought over and over, and the circuitry is still firing. That area in your body will still feel the tension, even if you're away from the trauma, and that's how just things cycles can keep recycling. With PTSD, because I have a lot of patients come with PTSD, majority of your patients have that with pain. The stories, have you seen like people like go through this and they go, the pain's gone? I know you have. We've talked about that, and it's just pretty miraculous. Yeah, I mean, there's a great book, Body Keeps the Score, that's kind of like a all-time going to look at if you're wanting to learn more about how trauma in the body and how that works and operates. Like I said, our nervous system is what runs the show, and so when we experience trauma when we're younger, so that is setting up your nervous system and your body to be an anxious nervous system. So just those repeated things that have happened over and over. So if you're one of those people that's like, I just feel like I've lived my whole life in survivor mode, you're probably one of those that have like an anxious nervous system. When you introduce a physical injury, that your nervous system absorbs that, and so if it gets laid into a nervous system that's an anxious trauma nervous system already, the likelihood of that becoming, instead of just an acute like illness that your body needs to handle, it increases the chances for it to turn into a chronic issue. So what she's saying is, if you've already been into fight or flight, and then you have another trauma on top of that, they can turn into a chronic disease or infection or sickness. How many people in the United States are in chronic fight or flight? Okay, so guys, we're gonna do a continuation of this, because this is gonna be one video, but we gotta keep talking, because this is really intriguing to me, because we're gonna get into fight or flight. So this is the first section of the first series, the first video, but love y'all. We're gonna talk more with Mel here. We'll see you in a bit. Thank you.